Bile duct cancer, cholangiocarcinoma, is a rare and aggressive cancer that forms in the bile ducts, which are tubes that carry bile from the liver to the gallbladder and small intestine. Cholangiocarcinoma can occur in different parts of the bile ducts: intrahepatic, inside the liver; extrahepatic, outside the liver; or at the junction where the bile ducts meet the small intestine. Symptoms of bile duct cancer. The symptoms of cholangiocarcinoma are often similar to those of other liver or bile duct disorders, which can make early diagnosis challenging. Common symptoms include 1. Jaundice. Yellowing of the skin and eyes due to the buildup of bilirubin in the bloodstream. 2. Itchy skin. A feeling of intense itching, often caused by bile salts accumulating in the bloodstream. 3. Abdominal pain. Pain or discomfort in the upper right side of the abdomen. 4. Unexplained weight loss, losing weight without trying. 5. Fatigue. Persistent tiredness or weakness. 6. Dark urine. Urine that appears darker than usual due to high bilirubin levels. 7. Pale-colored stools. Stools that are lighter than usual, a result of insufficient bile reaching the intestines. Causes and risk factors. The exact cause of cholangiocarcinoma is not always clear, but there are several risk factors that may increase the likelihood of developing this cancer. 1. Chronic liver diseases. Conditions such as cirrhosis, hepatitis B or C, or primary sclerosing cholangitis can increase the risk. 2. Gallstones. Chronic irritation from gallstones may increase the risk of bile duct cancer. 3. Bile duct inflammation. Conditions that cause bile duct inflammation, such as biliary strictures, are risk factors. 4. Parasite infections. In some parts of the world, infections from liver flukes, parasites, are associated with an increased risk of bile duct cancer. 5. Age and gender. Bile duct cancer is more common in people over the age of 50, and men are slightly more likely to develop it. Diagnosis. 1. Imaging tests. CT scans, MRIs, or ultrasound may help identify the tumor's location and size. 2. Endoscopic retrograde cholangiopancreatography, ERCP, a procedure that uses a camera to examine the bile ducts and take tissue samples. 3. Biopsy. A tissue sample from the bile duct is taken to confirm cancer diagnosis. 4. Blood tests. Elevated levels of certain liver enzymes or bilirubin can suggest bile duct problems, but a biopsy is required for confirmation. Treatment options for bile duct cancer, cholangiocarcinoma. 1. Surgical treatment. Resection, surgical removal. If the cancer is localized and in an operable position, surgery may involve removing part of the liver, bile duct, and gallbladder. This is the most effective treatment option when possible. Liver transplant. In rare cases, liver transplant may be considered for patients with certain forms of bile duct cancer. 2. Chemotherapy. Systemic chemotherapy. Chemotherapy drugs may be used to shrink the tumor and control the spread of cancer. Common drugs used include cisplatin, gemcitabine, and others. Adjuvant chemotherapy. Sometimes given after surgery to reduce the chance of the cancer returning. 3. Radiation therapy. External beam radiation. A treatment where high-energy rays are used to kill cancer cells or shrink the tumor. This is often used in combination with other treatments or when surgery isn't an option. 4. Targeted therapy. Targeted drugs. Medications that specifically target cancer cells or the molecular changes that enable the cancer to grow. These can be used when conventional treatments like chemotherapy are not effective. 5. Palliative care. For patients who cannot undergo surgery or other treatments, palliative care aims to manage symptoms and improve quality of life. This can include stenting to relieve bile duct blockages or managing jaundice and pain. Prevention and management. While you can't entirely prevent bile duct cancer, managing risk factors can help lower the likelihood. 1. Avoid chronic liver diseases. Vaccinate for hepatitis B and C, and limit alcohol use to reduce the risk of liver damage. 2. Regular screenings. For those at high risk, such as individuals with primary sclerosing cholangitis or a history of liver disease, Regular checkups and imaging tests may help detect early signs of cholangiocarcinoma. When to see a doctor. If you experience any of the symptoms of cholangiocarcinoma, such as jaundice, unexplained weight loss, or persistent abdominal pain, it's important to see a healthcare provider for evaluation and diagnosis. Would you like help with creating a YouTube title, description, or hashtags for this topic as well?